Welcome back to the Deep Dive Learner. So today I want you to picture something with me. Just follow an adult Havanese through a completely wonderfully ordinary day.
Okay, I love a good thought experiment. Let's do it.
Right. So the dog wakes up, has a nice big stretch, follows its person into the kitchen and, eats a carefully measured breakfast. Then it trots out for a morning walk.
Oh, greets a neighbor at the fence, maybe?
Exactly, yeah. Comes back inside, sits still for a quick brush. Later, it curls up near the family on the rug, barks exactly once at a strange noise out in the hallway, and then settles right back down to sleep.
It sounds incredibly peaceful. I mean, almost entirely mundane, really.
I know, right? Nothing dramatic is happening. There's no frantic vet visit, no sudden crisis, nothing that feels like healthcare in the way you and I usually picture it.
Yeah, we usually picture waiting rooms and clipboards.
Right. But here's the secret we're going to explore today. If you look closely at that perfectly ordinary day, preventative medical care is actually happening constantly, right there inside that quiet rhythm.
What's really fascinating here is how we've been conditioned to think of preventive care as an event. Like, we view it as a yearly appointment on a calendar, a place we drive to.
Right, like an annual chore.
Exactly. But today's deep dive is about fundamentally reframing that concept. Preventive care isn't an appointment. It's a rhythm woven into daily life.
Yeah, and we've gone through the notes, the veterinary guidelines, and all the behavioral records provided in today's source material for this.
We have. And our mission is to extract the most vital insights to show you how observing the mundane is actually, well, it's the ultimate health hack for an adult Havanese.
Okay, let's unpack this. Because if daily observation is the ultimate health hack, then the single most critical skill for you as an owner is actually knowing what normal looks like.
Knowing the baseline, yes, that is everything.
I like to think about knowing your dog's normal, like knowing the baseline hum of your car's engine.
Oh, that's a really good way to put it.
Right, because when you drive your car every single day, you know exactly how it sounds when you accelerate on the highway.
Yeah, it just becomes background noise, but you know it intimately.
Exactly. And because you know that healthy hum so intimately, the second there is a subtle, weird rattle, you hear it immediately. But you genuinely cannot hear the rattle of a problem if you never paid attention to the healthy hum in the first place.
That is a perfect analogy because it focuses on the mechanism of observation. You absolutely cannot spot a deviation if you don't have a baseline.
You just can't.
Right. And for a dog like a Havanese, the volume of normals you need to track is, well, it's expensive,
Yeah.
but they fall into distinct categories.
Like what kind of categories?
So you have the input and output. What is their normal appetite? How much water do they usually drink? And frankly, what does a healthy stool look like for them?
The glamorous side of dog ownership.
Oh, always.
Yeah.
And then you have energy and mechanics. Like, what is their baseline energy level on a random Tuesday afternoon?
Right. Are they sleeping or wanting to play?
Exactly.
Well,
What is their typical walking style? Do they usually sleep through the night or do they roam the house? You have to know all these things.
wait, I want to pause there because I think a lot of people assume their vet is the one tracking all of this.
Yeah, that's a huge misconception.
Right. But the vet only sees the dog for maybe, 30 minutes a year?
If we connect this to the bigger picture, observing these daily baselines fundamentally changes the entire function of your veterinary exam.
How so?
The vet visit is not the entirety of preventive care. It is simply the anchor point for the baseline you've been tracking all year. You are the resident expert on your dog's baseline.
And the vet is the expert on the medical side.
Exactly. The veterinarian is the expert in interpreting the medical meaning behind the deviations from that baseline.
So if I walk into the clinic, I shouldn't just be handing over the leash and waiting for the vet to find something wrong. I mean, I need to be bringing the data.
Precisely. A vet is evaluating their physical state on that specific day. Checking heart rhythms, palpating the abdomen, assessing joint mobility.
Right, the stuff we can't do at home.
Right. But they rely on you to tell them if the dog's bark has changed pitch, or if they're suddenly taking twice as long to eat their kibble.
Oh, I wouldn't have even thought about how long it takes them to eat.
It's a huge indicator. That partnership is what allows the vet to tailor vaccines to your actual lifestyle, or adjust their nutrition, or, catch a developing issue before it becomes an actual crisis.
That makes total sense. So since tracking that baseline is the foundation, let's look at where things start to go wrong. And I want to transition to the physical area where abnormalities most frequently sneak in completely unnoticed.
Which is almost always the head and face.
Yes, the dog's head and face. Now, let me play devil's advocate for a second here.
Go for it.
Wait, isn't bad breath just something we have to accept? I mean, people always say, oh, that's just how small dogs smell.
I am so glad you brought that up
Hmm.
because we really need to completely debunk that myth right now.
Debunk away.
Small mouths require very real, dedicated attention, and it literally comes down to basic anatomy. A Havanese has the exact same number of teeth as a Great Dane.
Wait, really? A Great Dane?
Yes, 42 adult teeth, but they're all crammed into a tiny, narrow jaw.
Oh, wow. I would have never connected those dots. So because of the crowding, they're physically more prone to issues.
Precisely. The crowding traps food particles and bacteria much faster than in a large dog's mouth.
Because there's nowhere for it to go.
Right. That trapped bacteria forms plaque, which hardens into tartar. But the real issue isn't cosmetic. It is systemic.
Systemic, like it affects the rest of the body.
Exactly. That bacteria causes gingivitis, and every time the dog chews, that inflamed gum tissue bleeds microscopically.
Ugh, that sounds awful.
It is. It allows oral bacteria a direct superhighway into the bloodstream, where it actively strains the heart, the liver, and the kidneys.
So small dog breath isn't a breed trait.
Not at all. It's the smell of active bacterial infection.
Wow. Which means dental care for an adult Havanese isn't just about them having some kind of Hollywood smile. It's comfort care.
Comfort care is the exact right term for it.
And it affects everything. I mean, if my mouth is throbbing, I'm going to be in a terrible mood.
Right. Just imagine having a persistent low-grade toothache for a year, but you can't tell anyone.
That would make anyone irritable.
It absolutely makes a dog irritable. It makes them snap when you try to wipe their face. They might drop food, paw at their mouth, or drool.
And people probably just think they're being picky or cranky.
Yes. And relying on dry kibble to scrape teeth clean is another myth. Kibble crumbles, it doesn't scrape. Toothbrushing and professional dental assessments are an ongoing, lifelong medical necessity, not just a grooming choice.
Speaking of the face, let's talk about eyes, specifically tear staining, because this is huge for the Havanese breed.
Ooh, it is a very common topic.
Right. I see owners obsessing over keeping the fur around the eyes perfectly white, trying every product on the market to bleach the stains.
And the focus there has to shift entirely away from cosmetic whiteness and toward actual comfort and mechanisms.
How do you mean?
Well, think of their tear ducts, like tiny gutters on a house. In many small breeds, those gutters are very narrow or very shallow.
Okay, I'm picturing that.
So when the eye produces normal tears, instead of draining down the nasal cavity like they're supposed to, the tears just spill over the side, onto the fur.
And then what happens? I mean, it's not just water sitting there, right?
Right, it creates a constantly damp environment on the skin. Yeast and bacteria treat that warm, wet fur like a slip and slide.
Oh, gross.
Yeah, and that is what causes the red or brown staining. And, more importantly, it causes severe skin irritation.
So if you see sudden thick discharge or swelling, or the dog is squinting and rubbing their face on the carpet,
That means something is actively causing pain. It's not just an aesthetic issue.
so please, learner, be cautious with eye products. You shouldn't be putting random bleach-based stain removers near their corneas without your vet's explicit approval.
Absolutely not. That can be incredibly dangerous.
And I imagine the exact same logic applies to their ears.
It absolutely does. The Havanese has drop ears, meaning the ear flap hangs down.
Right, which looks adorable.
It is adorable, but it physically blocks air circulation to the L-shaped ear canal. It turns it into a dark, warm, moist cave.
Let me guess, the perfect breeding ground for yeast and bacterial infections.
You guessed it. Regular observation is strictly required. You're tracking for a sweet or musky odor, head shaking, or scratching.
But again, never pour random over-the-counter drying agents or home remedies into a dog's ear without a vet looking inside first, right?
Definitely not. If the eardrum is compromised and you put the wrong fluid in there, you can cause permanent deafness.
Wow. That makes complete sense. Now, that hidden bacteria from the mouth or the ears doesn't just stay localized.
Right, like we said, if it enters the bloodstream, it affects the entire body.
Which brings us to the rest of the physical inspection. We're moving down from the face to the Havanese's defining feature, that incredible coat.
It really is beautiful, but it comes with a lot of responsibility.
It does. But I feel like their coat is so thick it could hide almost anything.
It absolutely acts as a disguise. It masks weight, it masks lumps, it masks skin conditions. That is exactly why your hands have to do the work your eyes can't.
You know, I like to think of regular grooming not as some luxurious spa day, but as a daily TSA pat-down for health.
I love that analogy, a daily TSA pat-down.
Right. You're gently feeling every inch, looking for anything out of the ordinary under all that fluff.
That's a highly accurate way to look at it because the mechanics of a matted coat are actually quite destructive.
Yeah, let's talk about mats. They're not just ugly tangles, right?
No, not at all. A mat acts like a clamp on the skin as it tightens. Every time the dog moves, that mat literally pulls the skin, creating micro tears.
Ouch, that sounds incredibly painful.
It is. And moisture gets trapped under the mat, and within hours, a painful, infected bacterial hotspot can develop completely out of sight.
Which totally explains why grooming is a genuine health issue, not just for looks. But I want to ask about itching, because people always seem to just switch dog food when their dog itches. I see this constantly on forums. They just keep buying different super expensive bags of kibble, hoping the pollocking stopped.
This is a classic case of misunderstanding the mechanism of canine allergies. True food allergies in dogs are actually quite rare.
Really? Because the pet food marketing makes you think it's the most common thing in the world.
Oh, I know. But the vast majority of canine itching is actually caused by environmental triggers, like pollen, dust mites, grass, or by parasites like fleas.
So changing the food isn't fixing the actual trigger.
Right. When a dog's skin barrier is compromised by environmental allergens, their histamine response kicks in, making them incredibly itchy.
So the food switch is just a wild goose chase.
Guesswork with dog food rarely solves a dermatological issue. It usually just upsets their digestion on top of everything else. You need a vet to determine what is actually breaching that skin barrier.
Good to know. And speaking of things the coat hides, wait.
Yes, the silent issue.
A Havanese can gain 2 pounds, which, for a small dog, is a massive percentage of their body weight, and you would never know just by looking at them because of the fluff.
Exactly. Their body condition must be felt by hand during that TSA pat-down. You need to be able to feel their ribs with slight pressure.
Like feeling the bones on the back of your hand.
Perfect comparison, yes.
Yeah.
Extra weight is incredibly taxing on their small joints and internal organs, and managing that weight requires rigorous honesty about what the dog is consuming from everyone in the house.
Okay, let me push back on this, because the notes say every single treat and table scrap needs to be counted.
They do.
But in a house with 3 kids or frequent guests, that is practically impossible. How does a normal family actually manage that without driving themselves crazy?
It's a very fair point, and the reality of family life makes it tough. But the most practical mechanism to manage this is the daily treat jar method.
The daily treat jar, how does that work?
You measure out the exact caloric allowance of treats for the entire day into a specific jar on the counter. Every family member must pull from that jar.
Oh, that's smart.
Right. Once the jar is empty, the dog gets 0 extra calories for the rest of the day. It completely removes the guesswork.
And it stops that compounding effect of 5 different people sneaking them a piece of cheese.
Exactly. No more accidental double dipping on treats.
That is brilliant. And it matters so much because that hidden weight gain we just discussed directly impacts the dog's mechanics, how they move, and their mind, how they behave.
They're entirely connected.
Which leads me to this. If I can ask you a question that I think confuses a lot of owners.
Go ahead.
If my Havanese, who has been perfectly house-trained for 5 years, suddenly starts having accidents on the rug or, starts barking constantly when I leave for work, is that them suddenly deciding to be spiteful, or is that a medical red flag?
It is absolutely, unequivocally a medical red flag. Behavioral regression is one of the most overlooked symptoms of physical distress in dogs.
Why do you think we overlook it so often?
We have to remember how dogs experience the world. They cannot say, hey, my knee aches, or I feel nauseous.
Right, they don't have words.
Instead, their distress manifests as a change in behavior.
Here's where it gets really interesting. We tend to separate training from health, but you're saying they're linked.
Deeply linked.
Yeah.
Let's look at the house training example you just gave.
Okay.
If a dog has hidden joint pain, the physical act of squatting or lifting a leg to pee becomes agonizing, so they hold it as long as they can.
Oh, that's heartbreaking.
And eventually they just let it go while standing on your soft living room rug because it's easier on their joints. It looks like a training failure, but the mechanism is just pain avoidance.
Wow. I'm struggling to see how that connects to the separation anxiety, though. I mean, why would a sore knee make them bark when I leave?
It taps into their primal instinct. When an animal feels physically compromised, they feel vulnerable to predators.
Right. They know they're weakened.
And their human is their source of safety. If a dog feels sick or in pain and their safety mechanism walks out the door, their anxiety skyrockets.
So that new clinginess or vocalization is a vulnerability response.
Precisely.
That completely changes how you look at a misbehaving dog. And you mentioned joint pain. For the Havanese, we really need to talk about their knees, don't we?
Yes, patellar luxation is a major focus for this breed.
The patella is the kneecap, right?
Yes, in a healthy knee, the kneecap slides up and down in a deep, bony groove. But in many small breeds, that groove is too shallow.
So the kneecap literally pops out of place.
Exactly. It slips out of the groove, causing a sudden mechanical lock.
That sounds terrible. Is that where you sometimes see a little dog walking on 3 legs for a second?
Yes, exactly. That's why you might see your dog suddenly skipping on a back leg for 3 steps and then walking normally again once the kneecap pops back into place.
And people probably think, oh, it's just a funny quirk.
But over time, that popping grinds away the cartilage, which leads to severe arthritis.
Which is exactly why that extra weight is so dangerous, and why daily wear and tear really adds up.
Yes, environmental factors play a huge role here.
Slippery hardwood floors where they lose their traction, or jumping off a high bed every morning, it forces those small joints to absorb massive impact.
Constant microtraumas.
Right. So if you notice a change in their gait, a skip, a hop, or stiffness that requires a vet visit, we cannot assume it's just a tweak.
Never assume it's just a tweak. And as their mechanics shift, their fuel needs to shift too.
You mean their food?
Right. Nutrition is a constant review process. An 8-year-old Havanese with a slowing metabolism and missing teeth cannot eat the same dense, hard puppy kibble they ate at age 1.
That makes sense. But again, keep the vet in the loop on those changes, right?
Definitely. The internet is full of trends, but switching to raw diets or grain-free formulas without a specific medical reason can introduce dangerous nutritional imbalances.
So this brings us to a broader perspective. We've gone from the microscopic bacteria in their mouth to the coat to their joints and their mind.
We've covered a lot of ground.
Now we have to zoom out to the environment they navigate every single day. And, more importantly, how we track all of this. Because let's be honest, human memory is a terrible medical record.
It really, really is. We misremember dates all the time.
Trusting your brain to remember exactly which day a subtle limp started or how many times they threw up last month is like trying to remember exactly what you had for lunch 3 weeks ago on a Tuesday.
You simply can't do it accurately.
You need a captain's log, an app like VitalPet, or even just a dedicated notebook on the fridge to track this data.
Because veterinarians rely on data patterns to diagnose.
Give me an example of a pattern versus an isolated event.
Sure. A dog losing 4 ounces of weight in a week might be absolutely nothing. But a dog losing 4 ounces every month for 6 months, that is a massive red flag for organ dysfunction.
Wow. Okay, I see the difference.
Keeping a log of their weight, their grooming observations, and subtle behavior shifts turns your vague impressions into actionable medical evidence.
And while you're recording that data, you're also managing their environment.
Right, preventive care extends to the home itself.
So making sure you have non-slip rugs on slippery floors to protect those patellas, securing toxic human foods, and being hyper-aware of hot pavement during summer walks.
We also need to talk about what's protecting them on a microscopic level in that environment: vaccines and parasite prevention.
Yes, these protocols are highly individualized based on your region and lifestyle.
Very much so.
And I want to highlight a crucial note from the sources on this because a massive misconception is that apartment dogs, or Havanese that mostly use wee-wee pads indoors, don't need parasite prevention.
It is such a dangerous myth.
Why is that? I mean, they're indoors.
Well, heartworm is transmitted by mosquitoes. And a mosquito does not care if you live in a high-rise apartment. It flies right in when you open the balcony door.
Oh, man, that is so true.
And fleas and ticks. They can be tracked inside on your shoes or picked up during a literal 5-minute walk on a grassy curb. Depending on your regional risk, indoor dogs absolutely still require robust preventive protocols.
Okay, so you've established your baseline, your home is safe, you're tracking your data in your captain's log.
You're doing everything right.
But things still happen. Instead of just listing off a million symptoms, how should a learner categorize the absolute non-negotiables, the red flags where we stop observing and immediately call the vet?
That's a great way to approach it. We can group the major red flags into 3 memorable categories.
All right, what's the first one?
First, we have the output. This includes repeated vomiting or diarrhea lasting more than 24 hours, any blood in the stool or vomit, or a sudden, unexplained refusal to eat.
And why is that immediate vet territory?
The mechanism here is usually acute gastrointestinal distress or an obstruction, and small dogs dehydrate incredibly fast.
Okay, so watch the output. What's next?
Second is the engine. This is their vital systems. Severe lethargy, where they literally won't get up, collapse, breathing difficulty, a persistent cough, or pale gums.
Pale dems mean bad blood flow, right?
Exactly. This indicates cardiovascular or respiratory distress. And time is absolutely of the essence.
And the third category?
The mind and mechanics. This covers sudden, drastic changes in behavior, like an aggressively hiding dog, sudden house training regression, seizures, or visible signs of mechanical pain, like severe limping or eye injuries.
Okay, that makes it so much easier to remember. Output, engine, mind, and mechanics.
Right. And the goal of knowing these categories isn't to create constant anxiety. By knowing exactly what requires immediate professional attention, you can allow the rest of your preventive system to just run quietly in the background.
So what does this all mean? If we bring everything we've talked about together, the core philosophy is profoundly simple. Adult Havanese do not need dramatic, constant medical interventions. They need consistent care.
Consistency is everything.
Dental care is actually comfort care. Grooming is a hands-on health conversation with their body. Weight has to be checked by your hands, not your eyes. And behavioral changes are just medical cries for help.
Ultimately, adult preventive care is the art of knowing what is normal for your specific dog and then fiercely protecting it.
Beautifully said. Prevention is not worry. It is paying quiet, daily attention before discomfort ever has a chance to get loud.
And building these habits, now, the data tracking, the daily TSA pat-downs, understanding the mechanisms of their body is exactly what makes the inevitable transition into your dog's senior years so much smoother.
Because eventually those knees will need mobility support, and having a decade of baseline data makes all of that easier to navigate.
It really does. This raises an important question, though, doesn't it? About how this concept of baselines and daily observation extends beyond our pets.
It really does. I'll leave you with this final thought to mull over, learner. We just spent all this time talking about how practicing this level of hyper-observant, daily attention to our dog's normal baseline makes us incredibly effective caregivers for them. It catches their pain before it spirals.
Right.
So how might applying that exact same quiet, observant tracking to the moods, the routines, and the baselines of the humans in our lives change the way we care for each other?
Oh, wow.
If we noticed a subtle shift in a loved one's hum, the way we notice our dog skipping a step on the stairs, how much relational discomfort could we prevent before it gets loud?
It's a profound way to look at caregiving in all its forms.
Something to think about next time you're on that morning walk. As a quick reminder, this deep dive is for educational purposes only. If you are ever concerned about your dog's health, always, always consult your veterinarian. Let's go back to that perfectly ordinary day. The breakfast, the walk, the quiet evening. There's magic in the mundane, you just have to know how it works. Thanks for joining us.